Hi class, welcome to lecture 1 of clinical nutrition. My name is Corrine Colin. I have my master's degree. I'm a registered dietitian nutritionist, a certified diabetes educator, and a certified nutrition support clinician, which means I specialize in tube feeding and parenteral nutrition, which is IV nutrition. So a little bit about me, you can read on your own, and I would like to hear about you. So for my in-class students, we'll be doing this activity. And the goal of today's lecture is to talk about the nutrition care process. The nutrition care process is a standardized process that allows registered dietitian nutritionists to give nutrition care to patients. And registered dietitians are uniquely qualified to provide nutrition care to persons in different states of health to help improve their nutritional status. And there is a whole spectrum of health that we are going to talk about. So health status can go from freedom of disease or somebody being totally healthy to maybe an acute illness such as a cold or a cough, or somebody who's susceptible to a disease, maybe somebody who's having some borderline micronutrient deficiencies. In this case, we could have some preventions to help prevent these small diseases from getting worse. In the third stage, we have chronic disease, which would alter somebody's capacity to function well or interfere with their normal day activities. And then we have permanently diminished capacity, where somebody maybe has organ failure, such as lung failure due to chronic obstructive pulmonary disease, or renal failure, or diabetes causing blindness. So there's a whole spectrum of disease. And hopefully the dietitian will be able to plan nutrition interventions depending on the status of health to help prevent disease from getting worse, possibly to reverse the disease process, and overall to improve nutritional health. So some of the factors included in nutritional health are listed here. And the very first step that a dietitian has to take is to assess what the nutritional health is. It's a doctor's job to assess overall health, but a dietitian can assess nutritional health. So some of the components we can look at are biological factors, which would be nutrients required depending on age, sex, genetics, growth, pregnancy, etc. Lifestyle factors, attitudes, knowledge, belief, behaviors, readiness to make a change, motivation, cultural factors, food and nutrient factors, which would include intakes, diet composition, quality of diet, quantity of diet, etc., bioavailability of nutrients. If you have an infant, maybe how the formula is prepared. Environmental factors, which would include socioeconomic issues, is there food insecurity? Are there cultural food preferences or avoidances? What's the education level regarding food and nutrition? Does somebody have reliable transportation to purchase food? Do they have safe way to store food? Food safety concerns? And then system factors. This could include healthcare access, food programs, food supply, health services, etc. And all of these are important components of addressing somebody's nutrition status. And I have a table explaining these in detail on this page. So we can do an example looking at this baby. This baby has failure to thrive, which hopefully you remember learning about in maternal and child nutrition. And so when we're looking at human biological factors for this baby, obviously the fact that this is a baby is significant because baby has significantly higher nutrient as far as calorie and protein needs because they're in a growth phase. They're different than an adult. This baby also is probably going to have a weakened immune system and be more susceptible to disease. And so we have to be aware of that as well. Lifestyle factors. This is going to be for this baby in more relation to the parents' lifestyle factors because the baby is 100% under their care. So, what are the parents' lifestyle beliefs about nutrition or nourishment? What are the parents' behaviors? Do they breastfeed or do they formula feed, etc.? Food and nutrition related factors. So, the type and amount of nutrients available for use by the body. Is this baby getting nutrition in an adequate quality or quantity? Does it get an adequate hydration? Is baby formula mixed appropriately? Is it absorbable to this baby? Or is there a lack of formula and this baby's getting fed cow's milk or something like that? Environmental factors. This is actually a picture I pulled from a search for Syrian refugees. So in this case, there are some huge environmental factors that play a role. There's definitely cultural preferences, economic. A lot of the Syrian refugees are living with huge cases of food insecurity, poverty, barely having a house over their head, access to safe water, etc. So food sanitation is a concern. And unfortunately, lots of babies worldwide that fall in these situations may die from diarrhea or malabsorption or diseases due to poor food safety. Then there is the healthcare system. There's probably very limited access to healthcare for a baby in a Syrian refugee camp, where if this baby was maybe in San Luis Obispo, California, they could go to WIC or they could go to community health or some free prenatal programs. And then the food supply system is limited. So we have to look at each case and evaluate those factors. The purpose of nutrition care is to restore a state of nutritional balance by influencing the factors that I just talked about. And RDs are the most qualified professionals to do this. They can do this first by identifying the causes of altered nutrition status, and they do this in the form of an assessment, which we're going to talk about in a lot of detail. There are a wide variety and interactions between factors that influence nutrition status, and depending on those, the RD can think about a very good intervention. So, for example, if somebody has inadequate nutrient intake and they're not eating enough, the RD has to decide why. Are they not eating enough because they can't swallow? Are they not eating enough because they don't have enough money? Are they not eating enough because they don't have transportation to the grocery store? Are they not eating enough because they're depressed, because their boyfriend or girlfriend just broke up with them? Are they not eating enough because they're just not hungry? Are they not eating enough because they feel sick or nauseated? Those would be all factors that the dietitian could assess. The nutrition care process, like I said before, is the standardized process that provides a framework for the RD to do their work. And so I did mention before, the very first step in the nutrition care process is nutrition assessment. It's a standardized process, but it doesn't produce standardized care. That means the care that the RD gives to each client is very individualized and specific for that client. But the way they go about deciding what kind of care the client is going to get is based on this standardized framework. This framework was developed to bring uniformity to dietetics care because before there wasn't any uniform way to document care or interventions and really assess outcomes universally between dietitians. So this is a wheel that has those same 4 steps of nutrition care process, starting with nutrition assessment, nutrition diagnosis, nutrition intervention, nutrition monitoring, and evaluation. And you can see this is a wheel with arrows that continuously go around because after you have done this once for a patient, you're always going to be reassessing to determine, is there still a nutrition problem? Did that intervention I thought of actually work, or did it not work? Do I need to think of a new intervention, etc.? On the outside of this circle in the blue is environmental factors that may influence care. In the inner circle, this orange circle, these are strengths of the registered dietitian. And then at the center of this circle is the relationship between the patient and the dietetics professional, because without any relationship, there's no trust to get accurate assessment information and plan an intervention. And so one of the huge goals in this class is to use the nutrition care process to identify patients at nutrition risk or patients who are already experiencing suboptimal nutrition, diagnose their nutrition problems, plan meaningful and achievable nutrition interventions, and monitor the progress as we go. So there has been a standardized nutrition language that's been developed. And like I mentioned before, this was due to previously there being a lack of uniformity between nutrition documentation. So what was developed is something called the nutrition diagnostic terminology. And this allows practitioners to more clearly classify conditions in a uniform manner. So when somebody says overweight, we have specific parameters for what that actually means. When somebody says malnutrition, there's specific parameters for what qualifies as a patient having malnutrition. When we have underweight, we have specific parameters for that as well. Food medication interactions, etc. And so this allows us to use evidence-based practice to document our nutrition assessment, diagnosis, intervention, all with standardized care. And this provides for better overall assessment of outcomes and stronger reimbursement for nutrition professionals. This is just another way to view the nutrition care process, and it is a standardized language that consists of concise phrases and terms. These terms are organized into domains, which we're going to talk about, and they actually use alphanumeric codes. However, it's not important for the RD to write down these alphanumeric codes. They can be researched later, but they can be used for tracking purposes. So, for example, the diagnostic term inadequate carbohydrate intake has the code N1-5.8.1106670, and that could be used in billing. I will add in this nutrition intervention terminology, there is one more part of this domain, and this is community care, but we'll see that coming up. So the very first part in the nutrition care process is nutrition assessment. And the domains of nutrition assessment can be kind of memorized with an acronym, A, B, C, D, E, and then N for nutrition. So during a nutrition assessment, the dietitian is going to determine whether a nutrition problem exists, whether a person needs a nutrition intervention now or in the future. And we're going to have an entire lecture on this coming up, but we can get into it a little bit now since it's the first and most important step. So the 5 domains include anthropometrics, which we'll talk about, biochemical data, client history, diet, which is food or nutrition related history, exam, which is a nutrition focused physical exam, and then nutrient needs, the calculation of nutrient needs for the patient. So, nutrition assessment, the very first part of this could be the diet history. So what do we already know about the patient? What does this patient eat? What does this patient know about eating? What does this patient know about healthy eating? How is this patient's appetite? What have they been eating over the last 24 hours? Maybe we do a 24-hour recall or a 3-day food questionnaire. Do they have any food knowledge or beliefs? Do they think they have to eat vegan, or maybe they have to eat gluten-free, or maybe they have food allergies? Do they have access to ways to prepare food, like a full stove, an oven, a refrigerator, pots, pans, knives, fresh water to wash fruits and vegetables? Do they consume non-food substances like alcohol or caffeine? How are their micronutrients? Are they getting adequate vitamins and minerals? And what is their physical activity level? That's PA. The second parameter within nutrition assessment is anthropometrics. So anthropometrics are things that can be very easily measured on the human body. So the height, the weight, the BMI can be calculated from height and weight measurements. A weight history. Have they always weighed this much? Did they recently gain weight? Did they recently lose weight? Were they trying to gain that weight, or was it unintentional? Were they trying to lose that weight, or was it unintentional? If you have an infant or a child, what do they look like on the growth chart? Are they normal for age? What percentile are they in? And then some abbreviations here: tricep skin fold, mid-arm muscle circumference, mid-arm muscle area. These are measurements that we can do in the upper arm to estimate subcutaneous fat as well as to estimate muscle composition. Waist circumference, hopefully you remember that a higher waist to hip ratio puts people at risk for metabolic disease. And we'll talk about many, many more further on in the course. Biochemical. So biochemical involves lab data, which is things that you could measure. Tests such as gastric emptying, indirect calorimetry. Gastric emptying would measure how quickly nutrients leave the stomach, probably using barium that could be tracked. And then indirect calorimetry would measure energy expenditure for requirements. Excess losses, vomiting, burns, diarrhea. If somebody's having diarrhea or a baby is, you could weigh the diapers. If somebody reports how much they've been vomiting, you could assess that. Burns often lose a lot of fluid. If somebody's urinating, you can measure how much urine is collected, etc. Nutrition-focused physical exam. So as a registered dietitian nutritionist, you are allowed to conduct a physical exam, and they found that physical examination can help learn more about the nutrition status. You can look at the overall physical appearance. What does the skin look like? Is it healthy? Are there breaks in the skin? What do the hair and nails look like? Do they look healthy and shiny, or are they brittle, or people losing clumps of hair? Is there muscle wasting or fat wasting? Is there edema, which is swelling? You could ask somebody about their swallow function. You could ask them to look in their mouth and look for adequate dentition, or missing teeth, or oral infections. You can look at the tongue, you can look at the eyes, you can look at the skin color, you can look at wounds. And then affect is kind of the overall appearance of the person. Do they seem with it? Do they seem animated? Or do they seem kind of out of it? One of the last parts is client history. So personal, medical, health, family, treatment, social. Who do they live with? Who does the cooking? Who does the shopping? When's the last time they went to the doctor? What did the doctor say? Is their family supportive of what they're doing? Or does their family maybe have some alternative health beliefs? What treatments have they tried before? Or what nutritional treatments are they interested in? Do they live alone? Do they suffer from depression? Do they know how to cook? Do they not know how to cook? Etc. So those are all really important components of nutrition assessment. The next step of the nutrition care process is nutrition diagnosis. And the nutrition diagnosis is a direct link between assessment and intervention. It will describe a problem for which nutrition-related activities provide the primary intervention. And so one of the very important things to consider with regards to nutrition diagnosis, it is different than a medical diagnosis. Registered dietitian nutritionists cannot give a medical diagnosis. That is not within our scope of practice. However, we can give nutrition diagnoses, and there are quite a few that we can choose from, and they have been published using nutrition terminology, and they're in your lab book as well as your lecture book. So there are 3 domains, which means different categories of nutrition-related diagnosis. So the intake domain has to do with inadequate or excessive intake of a nutrient, maybe excessive energy expenditure, etc. Clinical domain is related to a medical condition, so maybe related to altered chewing, swallowing, impaired absorption, involuntary weight loss, underweight, overweight, unintentional weight gain. And then there's the behavioral environmental domain, which may be things like food and nutrition related knowledge deficit, limited adherence to nutrition recommendations, inability to manage self-care, not ready for diet or lifestyle changes, etc. When we form the nutrition diagnosis, we form it in a very specific way. When I say form, I mean write. And so we have to write the nutrition diagnosis using something called a PES statement. P stands for problem, or the diagnostic label. So for example, a problem could be overweight. A problem could be altered nutrition-related lab values. E stands for the cause. What caused that person to be overweight? Was it that they ate too much food? Was it that they have Prader-Willi syndrome? Was it that they didn't know anything about nutrition? What caused that problem? And then what are the signs and symptoms of that problem? So how do we know that they're overweight? So in the case of overweight, a sign and symptom could be BMI 29. That would be a sign of overweight. If somebody had a nutrition-related knowledge deficit, a sign or symptom could be that they are consuming only fast foods, or they're only drinking Diet Coke and eating macaroni and cheese all day long. So the signs and symptoms are kind of the proof of the problem. So we will measure the signs and symptoms. And so the signs and symptoms often come from components of the assessment, like a 24-hour recall could be a sign and symptom. A waist to hip ratio could be a sign and symptom. A blood glucose value could be a sign and symptom. And so we always word our PES statements this way: the problem related to the etiology as evidenced by the signs and symptoms. So for example, involuntary weight loss related to inadequate energy intake as evidenced by 8 pounds weight loss within 4 weeks. And we're going to go over a lot of these in the class. Another example would be inadequate energy intake related to changes in taste and appetite as evidenced by average calorie intake 50% less than recommended needs. So how do we get to the PES statement? Well, you have to find patterns within the data. And within the data, I mean the assessment data. And you have to make inferences. You have to suspend judgment and only look at the facts. So that's actually a good question here. We're going to go back to this woman. So this woman, I'm going to first ask you to make some judgments. She's got 2 cookies in her mouth, 1 in the glass of milk. What could be a possible nutrition diagnosis for her? Well, without knowing her very well, we could pass some judgment. But in order to make the most complete diagnosis, we need to thoroughly assess her and ask a lot of questions about the nutrition situation. All right. So we could assume that this person has, from our diagnosis list, excessive energy intake. Maybe they have excessive carbohydrate intake. Maybe they have less than optimal intake of types of carbohydrate. Maybe they had disordered eating pattern. Maybe they have undesirable food choices. But that would be with just looking at this picture. But then what if I told you that this person just went and ran a marathon? Would you think there's a nutrition diagnosis then? I personally wouldn't. I'd say this person just earned those 3 cookies and just about whatever else she wants to eat. So you really have to examine the whole situation. If I told you this was a type 1 or type 2 diabetic, we might have a nutrition diagnosis. If I told you this was a teenager, we might think, you know what, this is kind of normal for a teenager. If I told you this person has celiac disease and these are not gluten-free cookies, that could change our diagnosis as well. So it really just depends on the situation. Okay. So we were here. And so in order to get to the best PES statement, you have to evaluate the entire patient. And just really find out what's happening. You have to rule in and rule out certain diagnoses, and you may come up with multiple diagnoses. It's actually okay to have multiple problems. You could have maybe 1, maybe 2, even 3 PES statements, and you would prioritize them in order of what's most important. Some of the things that we want to consider is when choosing a PES statement is a set of questions that we can answer. So this set of questions includes Can the dietitian resolve the problem? Does the etiology or the cause make sense, and does it match the assessment data? Does the nutrition assessment data support the problem? So if I say she has altered nutrition-related lab values, I should probably list that her albumin is low and her blood glucose is high. Is the etiology actually the cause? So what is the true cause? This is where you have to dig deep. Is there a reasonable intervention that is based on the etiology, or will at least reduce the signs and symptoms? So can we fix this? And remember, we are not fixing medical problems, we're fixing nutritional problems. So a good example of that one is there is a diagnosis you can choose that is altered GI function. But I always ask people to ask the question, can you, as the dietitian, fix their GI function? Usually, in my opinion, the answer is no. I think that's usually a medical fix, but it just depends. Maybe if they have altered GI function and they're having flare-ups from celiac disease because they're eating a lot of gluten, maybe you can fix that. Another one is difficulty swallowing. That's a nutrition problem, but can you as the dietitian fix that, or is it the speech therapist who's going to help fix that? So there's nutrition problems that are maybe more appropriate for the dietitian to fix than others. Other things to answer: can the registered dietitian nutritionist monitor the patient on the basis of signs and symptoms? So can you monitor outcomes? Like, could you track blood glucose? Could you track weight? Could you track diarrhea, etc.? And if you have a domain to choose from, the intake domain is the preferred domain. So, nutrition intervention. Nutrition intervention is a purposely planned action designed with the intent of changing a nutrition-related behavior, risk factor, or environmental condition or aspect of health. And we're going to identify ideal goals and expected outcomes. So, for example, desired changes to be made, maybe specific or behavioral. For example, substituting water instead of soda, or getting your blood glucose below 180, or improving your albumin to 4 or higher. And we're going to use the nutrition care process to do this. There are 5 domains in nutrition intervention. And these are different categories for how we could intervene. So things that we need to consider when deciding what our intervention is going to look like is, what is the problem severity? What is the likelihood that our intervention will impact the problem? What's the patient or client's perception of the problem? Are there any safety issues? And can we think of smart interventions? So, for example, we need to monitor progress and measure outcomes. And this is for the nutrition monitoring and evaluation step. This would be after we have our intervention, we're going to monitor how well it worked. So, for example, in this last slide, if I provide nutrition counseling as intervention, I need to check back with the patient to see, have they made any behavior changes as a result of that nutrition counseling. If I do food or nutrient delivery, maybe I'm going to sign a senior up for Meals on Wheels, and they're going to have 5 meals a week delivered to their house. Is that going to improve their calorie intake? I could assess that. Coordination of nutrition care. Maybe I do have somebody with trouble swallowing. I might need to refer them to a speech therapist. Maybe I have somebody who's just not eating because they're depressed. Maybe I'm going to refer them to the social worker. Population-based nutrition action. This might have to do with community-wide interventions. So maybe making the water safer, fluoridating the water, etc. Nutrition education. If somebody is a newly diagnosed diabetic or has gastric reflux disease, I'm going to provide them education to make those problems manageable, and then I'm going to follow back up in a month. Did what I taught them actually work, or were they able to remember it? And so when I do all these interventions, I want to make sure that they happened. I'm going to monitor the progress and measure the outcomes. You can often monitor progress and measure outcomes based on signs and symptoms of the disease, and maybe based on the etiology of the disease. One more thing. So, for example, I could compare current findings with previous findings. So, for example, if my problem was overweight and my sign and symptom or my proof of the overweight was a BMI 29, if I went back in a month and I measured the person's height and weight and calculated their BMI, and now their BMI is 28, I would say that was a pretty successful intervention that I did. I could also look at blood glucose records, which is shown here. So for example, if my patient, when I first meet them, has blood glucose values in the 200s, when I check back in them 2 weeks after I've done some nutrition counseling and education, and I see blood glucose levels in the 170s, even though it's not perfect, I'm going to say that was pretty good progress and we're on track. So monitoring and evaluation is the last step of the nutrition care process, and you actually can monitor and evaluate every single domain from nutrition assessment. So all of those domains that we first measured in nutrition assessment, we're going to use again in the monitoring and eval. Did their anthropometrics change? Did the nutrition-focused physical findings change? Did medical tests or lab change, etc.? This is a diagram of how the PES relates to the nutrition care process steps. So remember, the first step is assessment. Then you design your diagnosis, the problem, the etiology, and the signs and symptoms. Based on the cause of the diagnosis or the cause of the problem, you design a nutrition intervention. The nutrition intervention should be able to address both the cause of the problem and hopefully the signs and symptoms of the problem. After you've designed your nutrition intervention, you're going to monitor and evaluate the results of the nutrition intervention using the same assessment parameters that you used in the beginning. And so after this process is complete, you could reassess and reassess and reassess. So when we're writing our ADIME notes, which we're going to write in class, and you're writing the monitor and evaluation process, you're going to write something like, RD will follow up in 1 month and at that time reassess BMI, blood glucose, patient beliefs, practices, etc. If you reassess all those parameters and they're now within goal, this person may not have a nutrition problem anymore. If you reassess those parameters and they're still out of goal or they're worse, maybe you need to think of a different diagnosis or intervention. So critical thinking is key to the entire nutrition care process. And critical thinking is something that is expected of a registered dietitian nutritionist and something that hopefully you have developed throughout your education here at the university. So critical thinking is organizing and integrating information, identifying relationships, making references, forming conclusions, and making decisions. And it challenges our assumptions, it helps us create alternative solutions, and ultimately make informed decisions on what would be best for our client. Some of the components of critical thinking involve the standards of nutrition standards and attitudes of the patient and dietitian. And we have a big component on critical thinking coming up. Specific knowledge based. So each dietitian has a specific knowledge base that is required for them to become a certified dietitian nutritionist. And by having this education level, they're able to make nutrition evidence-based decisions and plan nutrition evidence-based interventions for their client. They have to maintain their knowledge base. So every 5 years, for example, a registered dietitian nutritionist needs to take 75 units of continuing education so that the decisions that they make for their clients are based on the most current research that's out there. They need to think about their values such as integrity, fairness, non-judgmentalness, etc., and then standards of professional practice, which we'll talk about a lot later. This is a chart explaining or giving examples of the role in critical thinking for the 4 different steps of the nutrition care process. So for example, nutrition assessment, you have to think critically to determine what data is appropriate to collect. For nutrition intervention, you have to use critical thinking to prioritize the goals. You might have a patient who has 4 problems, but which one is the most important? Which one is the most important to the client? And which one is the one that you as a nutrition professional can actually solve? Documentation. As registered dietitian nutritionists, we document all steps of the nutrition care process, like I already mentioned, using standardized language. And even though the language is standardized, there are different documentation forms still using that language. So for example, there's SOAP notes, that means subjective, objective assessment and plan. There's focus notes, there's PI notes, there's ADIME notes, which we're going to use in this class. And then there's electronic medical records, which may or may not incorporate part or all of those different types of notes above. It is a requirement that healthcare is transitioning to the electronic medical record, so you will see this more and more frequently. However, it's also very possible that you could be writing a physical handwritten note, which may then be scanned into the electronic medical record. This is an example of the electronic medical record, and you can see this is a nutrition assessment tab where you're picking nutrition problems, charting the weights, etc. And this makes charting and tracking pretty easily. And then this is just another example of a form I actually used to fill out a nutrition assessment on a patient. This is a form for a SOAP note. So as you can see, there's lots of different ways to conduct a nutrition assessment. And in summary, we talked about the nutrition care process, the purpose of it, the steps of it, and many nutrition status factors that can affect health. So we will continue next time, and I'll talk to you then.